On behalf of the Hepatitis B Foundation and our partners at the Association of Asian Pacific Community Health Organization, APCHO, I want to thank you for joining today's webinar. My name is Catherine Freeland, and I'm the Public Health Program Manager at the Hepatitis B Foundation. We're excited to present today's session on building and maintaining a Hepatitis B coalition. Before we get started, I'd like to review a few housekeeping items and let you know how you can participate in today's webinar. Please note that all attendees are in listen-only mode and will be muted during the presentation. There's also a phone-in option and call-in numbers below. You may submit questions in writing during the presentation and type them into the question box in your GoToWebinar control panel. We will be reviewing them as they come in, and we'll hold a question and answer period after the presentation. And finally, today's webinar is being recorded. You will receive an email with a link to view the recording of today's presentation after the webinar. Now I'd like to introduce our presenters. Today we're featuring Wen-Chi Chen, the Program Coordinator, Patient Navigator at New Jersey Hepatitis B Coalition and the Center for Asian Health at St. Barnabas Medical Center in Livingston, New Jersey, and she'll be co-presenting with Ruth Brogin, Program Manager at the New Jersey Hepatitis B Coalition Center for Asian Health at St. Barnabas Medical Center in Livingston, New Jersey. In addition, they will be featured with Mohammed Abdul Qadir with the Hepatitis B Coalition of Washington State, and he is the coordinator there. And he also works with the International Community Health Services based in Seattle, Washington. With that, I would like to turn it over to Wen-Chi Chen, who will be presenting on New Jersey Hepatitis B Coalition.
Thank you, Catherine. Hi, everyone. It is Wen-Chi Chen. I work with the Center for Asian Health at St. Barnabas Medical Center. And then today I'm going to co-present with Ruth. It's also our program manager in Center for Asian Health at St. Barnabas. Yes, we work with Dr. Su Weng. That's our that's our program leader. And then everybody talking about hepatitis B in United States, everybody will mention Dr. Su Weng's name. So later on, we will just introduce a little bit how we start our coalition, and then how we build up our coalition until now. So before I start, I just want to let people know a little bit about Center for Asian Health. We are a medical clinic. We have 5 doctors, 3 internalists, and then 2 specialties. One is cardiology, one is GI doctor. So we also do a lot of free Hep B screening event as a clinical setup. It's kind of like easier for us because it's easier to follow up with the patient. But also the challenge is that all of the patients have to travel to our locations. So and then our Center for Asian Health start joining the Hepatitis B Coalition since 2014. So, you already have next slide. Good. Okay, so a little bit background about Hep B Coalition. We're starting from 2012, and then it's just starting from an idea that Dr. Daniels from Department of Health, she's getting this idea from Charles B. Wong's in New York City. She just went on to a Hep B conference, and then Charles B. Wong shared a lot of information about how they build up New York City Hep B Coalition, and then what kind of activities that they have in the future. So she bring back this idea to New Jersey, and then start just working with a couple groups of people to see if it is suitable. So we are so lucky to have like 8 groups of people from different organizations to join. In 2013, we invite Sherry, director of Hep B United Foundation, and then she provides virtual orientations to New Jersey organizations to convene at the St. Peter Health System New Brunswick, New Jersey. That's Central Jersey. So that location is very good. It's because New Jersey has like 21 counties. From the north to the south, it takes like a 5 hours drive. About 5 hours drive. So definitely that most of our event we will just locate it in the Central Jersey. So just our first orientation is also in Central Jersey, New Brunswick. So on 2013, we have this. After we have this orientation, we find out that Dr. Su Wen start working with the St. Barnabas Medical Center. So our chair, Dr. Daniels, just start approaching to Dr. Su Wen, and then both of them co-chair in 2014. That's how we start our Hep B Coalition from that. And then from our founder member, you can tell we have I only list 5 of them, and then we also have the other 3 of them. So Office of Minority and Multicultural Health at New Jersey Department of Health. That's the department that Dr. Daniels belongs. And then also we have Mohammed Medical Center. That's also part of our Barnabas Health System. And then Holy Name Medical Center, St. Peter Health System, and then Monmouth County Department of Health. And then we also have Bergen County. Monmouth County is more Central Jersey, and then Bergen County is more Northern Jersey. So we have Bergen County Department of Health, and then we're also including also have New Jersey Hospital Association. So this organization, they participate in the first orientation and then start the Hep B Coalition from 2013. So then next slide. Thank you. So I just want to mention about from the member list that we can see that our member based from hospital. We have Holy Name Hospital. We have a Monmouth Medical Center, St. Barnabas Medical Center, St. Peter Medical Center, St. Peter Hospital. So it's basic just a lot of hospitals. And then we also have local health departments, Monmouth County Health Department, Bergen County Health Department. Now we also have Livingston Health Department, our city. And then also we have the social organization American Cancer Society, New Jersey Hospital Association. So we can kind of divide our member base from this kind of these 3 categories. So it's really good to have different different base, so we can have different poaching area to reach out to many people. So for example, for the hospital base, we can reach out the people who care about their health at that moment, because people have some issue, they went to hospital, and then or they just do the physical exam, so they went to hospital. It's more like people already care their health. So when they give out the Hep B information, they will more likely they will be accept about this information. So that's a very good way to also have the hospital to be one of our members, because they provide a lot of this kind of information to the patients. And then also we have a local health department. They reach out to the people who need follow up with their health issue. So for example, most of the time we need to report the Hep B patient to the local health department, and then local health department will follow up with this Hep B patient. Or if the lab tests Hep B positive, they will just report to the local health department, and then local health department will just contact the patient and then make sure the patient go on the follow up. So it's also good to have local health department to join the Hep B Coalition. They can get more information, the newly released information to share with these people who need follow-up. The social organizations reach out to random community. They have a lot of community events. They have a lot of community volunteers. If they can just pass this information to their random volunteers, the communities, that would be a big hit to the whole state, big hit to the community. So it is good to have a different base of members, but it also have some major challenges. We still need a lot of communication between these members. For example, that the hospital always, a lot of hospital has the same or similar program. We do Hep B free screening in our clinic. Of course, in the other hospital, they might have their Hep B program also, and then it's also free screening. So we end up like we went to some of the community event, and then we will see that different hospitals provide the same service, free Hep B screening. So that kind of just showing that we lot of communication with each other. And then also a lot of local health department runs differently because we have like 21 county for the statewide, and then every single county has different city department of health. So for example, Livingston, it's under Essex County. Essex County have one department of health, and Livingston has their own department of health. So sometimes they run in different ways. Some of the department of health, they show they doing things like they would like to contact the patient by themselves. But some of the Department of Health would like the doctor to follow up for them. So it's like different department has different kind of different system to run, and then of course different local Department of Health, they only cover the area that belong to their community. So if you have like an event in the other city, the Livingston Department of Health may not go over there to the event, and then or like if you have some event in Livingston area, the other counties Department of Health won't support this event because that's not in their community. So some of the Department of Health, they would like to hosting their own health event. So become like we might need to just like end up every single weekend we go to different kind of event. So it's kind of like showing people that it is good to have a different member base, but also it is difficult for to make this difference to communicate with each other and then come up with agreement. So become like we need a lot of communication. So next slide. So we break down different ways to communicate with each other. We have phone conference. We have different community events. We also have the Google Groups, and then of course we have the face-to-face meetings with each other. But every single way to communicate with each other, they have some success. Also have some challenges. So for New Jersey Coalition, we're using a phone conference. We're using phone conference like every quarter, once a month. In the beginning, it's every other week, and then we find out that it's too frequently. Not everybody going to participate. So we become like once a month, and then now we become like once a quarter. So it is good. It's because there is no distance. Like with a statewide member, it's a phone conference. It's a very good way to communicate. They don't need to travel around, and then easy to access because you can just like pick up the phone, dial the number. You can join the call. You can join the conference, and then also you can invite some of the non-member to participate in the call. When they get the information and then they feel interesting, they might be become our future member, right? So it's very good to have this kind of phone conference. But of course, it's difficult to tell like how the people react about this conference. So we still need a lot of work because like people join the conference, yes, but you couldn't tell that if the people like it or not. Sometimes people drop from in the middle of the conference. You have no idea why the person dropped. Is that because the topic too boring or they didn't get the information they want? So most of the time we have to go back and then to find out that what's going on with our conference call. So and then we also find out like a lot of members, they never participate in the call. Even though we keep sending reminder or something, but they never go on the call. Is that because our topic is not interesting to them? We try to reach out to them and ask them why, but a lot of people just say, oh, we're too busy or something. But we really try to accommodate everyone's schedule, but still like really difficult. So it is a good way to communicate, but also have a lot of challenge. So for next page, next slide, thank you. So we're thinking about that. Okay, so conference call it's not the only way. We can try the other ways to communicate with the people who cannot participate from conference, but also can feel like involved by the New Jersey Coalition. So we start inviting a lot of members to our community events. The community event is really good. We can directly pass the information to from the coalition to the community. That's a very good. And then when we meet some organization representative, we can directly recruit them as our member. It's a very good way to recruit people. Or that we can invite them to one of our meetings, like phone conference. We can invite them to our phone conference. And then most of the time, we can also invite our members to join the event as a vendor or as just participator. Sometimes we can ask them for help and just stop by to coalition booth, and then we can take shift to watch our booth. Just try to make our members have be involved with some of our coalition activities. Most of the community event is on the weekend. So that will be one of our difficult challenge. It's really difficult. It's because it's weekend. So not a lot of members may be able to participate. Sometimes we are happy just people stop by. So we even if you couldn't participate, that's okay. Just stop by. So that's one of our challenges. It's because a lot of community events during the weekend, and then a lot of community event it's like in one location. So of course it's lack of interest to some of the participators because it's too far away from their person, or it's not in their community. Just like I said before, a lot of the Department of Health they are our member, but they only care about the stuff like happen in their community. Outside the community, they consider it's not their territory. So definitely that they might not interesting to participate. This picture is very interesting. It's because this is an event that hosted by one of our members, and then Dr. Su Wang, of course, our co-chair. Dr. He is from St. Barnabas Medical Center, and then also the other on your right hand side, that's Mr. Chang from American Cancer Society. Now he is in New York City Coalition. So it's a member. This event is cooperated by one of our coalition members, and then they invite St. Barnabas Medical Center to join. So since we are part of Hep B Coalition, we send out a message to the group and telling people that, hi, we have this event hosted by this organization. We really hope that you can join as a vendor or just stop by and participate. So we get a whole bunch of response. Some people just stop by, and then so lucky we have also have American Cancer Society to set up a booth with us. So that's why it's really good to have the community event to really communicate between our members. So next slide, sorry. So next slide is also one of our community events. This is community event. It's hosting by Center for Asian Health, but all of the coordination it's from our Hep B Coalition intern. He helping us to set up the whole event. This event we're showing a movie from China. They're shooting from China, and then talking about lots of different happy story, and then how happy impacts their life. So and then our intern helping us to coordinate it. It's in one of the local theater. It's a movie theater, and then they open an auditorium for us just to showing this movie, and then also helping us to advertising this event. So next one. So from that event, it's coordinated by our Hep B Coalition intern. So this event is a really good. It's a good example. It's because the New Jersey, we have a member from New Jersey Immunization Conference, and then they participate the year before, and then they feel that it's a very good opportunity for Hep B Coalition to participate, and then to give out the information about Hep B vaccination. So they invite us, and then this event, every single vendor needs a sponsorship for that. So since one of our members already have a booth, so they just so generous to share half of the booth with Hep B Coalition, so we can have a chance to showcase our information to the patient, to the community, and then also to the other organization. So it's also the other good example for people, for our members to join the community event, and then also invite a coalition to be one of the guests. So next slide. So we're thinking about very good to have the phone conference. Of course, that's a lot of challenge also. And then we're using community event to communicate, to try to encourage people to involve with more activities. And then we find out we still have some more people that cannot participate, or because of they are too far away, because it's in weekend. So we start the Google Group message. So Google Group message, you can just directly receive the post from the email. So it's it is easy to post the information on Google Group, and then one post, all of the members will see it by email, from the email. So like, you don't need to sign into the Google Group to get the information. You can just say, turn on your email, open your email, you will see it. So sometimes we will post like job opening in the Department of Health that relate to Hep B. Last time some of the location site, they would like to see if can find some bilingual agent to help people sign up for the health insurance. So when we post that, we have a couple local site can just get some of the resume, because we post it in our Google Group, and then some of the members saw it, and then share this information to their groups. So that's a very good way to communicate with each other, and then also share the information. And then because it's this Google Group, it's automatically sent out to the whole group. You don't need to copy paste all of the email address or type in the email address to make mistake. So Google Group, it's helping us a lot to post a lot of information, but also it has a lot of challenge, because it's kind of like a mass email. So some of the organization, they block it. So a lot of email went to the spam mail, and then some of the members never get it. And then the other thing is that a group member, they reply the post, but because of it is a spam, so the other people never saw any reply, never saw this communication. So it's kind of like really difficult for us to make sure that everybody gets the email. And then the other thing is I don't know, is that because of the spam or people like reading email and then that's it. So we have less than 10% of members respond to the Google Group. I mean, respond, it's like really reply the post, or respond to the post and then reply the email. So we have about 70 members on our list right now, so, but it's only like about 8 people to 9 people that really reply this post on the Google group. So it is good, but it still have challenges. It is, and then the other challenge is like this Google group. We post the conference schedule, everything, but we cannot invite people to the conference through the Google group. We have to just pull out the email address and then send out use the other software to send out the invitation. So that will be the other challenge. It becomes like only one-way talk. No, like we get just difficult to get people's feedback. So so even though it's Google Group, it's good for us to post the information, and then people can share this information to their group, and then with a lot fire the right person to the right position. But the same thing that still have a little bit challenge for us. So we also thinking about, do we have the other way to encourage people to join our activity, to really feel like participate the New Jersey Hep B Coalition. So we have a next slide. Next slide, thank you. So we start our first coalition from. We start on 2014, and then we are planning for our next one. And we choose the location is Central Jersey. Like I say, from the north it's about 2 hours, 1.5 hours. From the southern part it's also like 1.5 hours. So Princeton is also a Central Jersey. So we have over 50 participate this from, and then from different locations. The southern, even from Atlantic City to participate our conference. It's very good. People get chance to meet face to face, and then we are so lucky to have a New Jersey Hospital Association. They willing to sponsor their beautiful conference room for us to use. So, and then of course the New Jersey Hospital Association is also one of our coalition founder. And then our event sponsor, most of our event sponsor is from our member list. And then, for example, like Gilead, one of our member, and they support our conference for the first conference. And then we have also a couple of hospitals support our conference. And then we invite 2 keynote speakers. We find out that keynote speaker really attract a lot of people to participate in this conference because the topic is interesting. We have 2 keynote speakers. One is Sherry from the Hep B United, and then the other one is from Department of Health, New Jersey Department of Health, Dr. Christina Tent. She's also epidemiologist in the Department of Health. So she give a very good talk to the coalition. So the good topic with attractive, good keynote speaker that attract a lot of people come to, even non-member, they're willing to participate. So it's also the other good way to recruit new member. From this event, we recruit about 10% of our membership, our coalition member. So it's a very good way to attract people and then recruit people to be our members. So of course, it is good, but also it's a lot of challenge with that. You need to find a good location, you need to find a good sponsor, and then of course a conference costs money, costs everybody's time. So we try to just do it every other year, and then so we are planning to have one in this year. And during a lot in this past years, we have a lot of success, we have a lot of challenges. So we're looking forward to our next page, to our future. So Ruth, since I've been gone for I've been my maternity leave for 6 months, and then my very good teammate Ruth, she take care of a lot of coalition work with Dr. Wong and me. So she's going to share a little bit our future and then our next page. Ruth.
Okay, thank you very much, Wenchi. I'm just going to expand a little bit on some of the challenges as well that Wenchi had alluded to and how that became the base for what we are planning in the future in 2017. One of the biggest challenges of the New Jersey Hepatitis B Coalition has been building a statewide coalition that is reflective of our diverse state. Although New Jersey is one of the smaller states of the 50 states in the United States, our state is very diverse in many different respects. There are 21 counties in this state, and the logistics of traveling from one end of the state to the other needs to be considered when planning, especially planning community events. Geographically, New Jersey can be divided into the north, central, and southern regions, which each region can vary greatly by demographics, race, ethnicity, languages spoken, and socioeconomic status. What this does is translate to a varied list of community health needs within the state of New Jersey, and therefore a varied list of actions, goals, and community events that need to be generated. As Wenchi had mentioned, New Jersey's health departments are very unique, and in particular, their structure is very unique. Wenchi mentioned their strength in their ability to work directly with the patient. However, there is a challenge when we take it from a programmatic perspective. There are 21 counties in New Jersey, and each one of them can have more than one municipality within the county. In New Jersey, every municipality is required to be served by the local health department that meets the state public health laws and regulations. Therefore, some municipalities have their own local health department while others share. This all lends to many health departments for one state, more than is typical compared to one of our sister states. So many that it's estimated that New Jersey health departments comprise 20% of all health departments in the U.S. Another issue is the accessibility to work with their staff when many towns, municipalities share health departments with part-time nurses. Therefore, it becomes difficult to plan events relevant to a community, let alone setting up the logistics for a successful event. What this does is that it just winds up being a very decentralized public health and fragmented efforts, and this makes it very difficult for the coalition to effectively partner with the local health departments from a programming perspective. Next slide, please. So as we think about our challenges and our successes, we think about in the year 2017, the future of the New Jersey Hepatitis B Coalition. And in light of our challenge of building a, quote, statewide coalition to address the various needs which I discussed, we thought a focused effort would be more efficient use of coalition resources in the coming year. Therefore, we plan to develop a regional focus in our planning and specifically concentrating on the northern part of the state. We chose this northern region for two reasons. There is a higher Asian American Pacific Islander and African immigrant population in this region, which would benefit from Hep B education, prevention, and community efforts. Also, we could leverage hospital and Department of Health partnerships, which Dr. Suwong and Dr. Daniels, our co-chairs, have developed. When she spoke of the success of our GoToMeeting web conference / phone conferences that we have, this does provide an easy way to gather members statewide for a meeting. However, it also presents an easy option for a member not to participate or be accountable to being a member of the coalition. Therefore, we are forming a steering committee for the coalition in the hopes that it will provide as an incentive to serve and be active in the coalition. By agreeing to serve on the steering committee, a member will provide valuable leadership and direction to the coalition at large. We are in the midst of drafting a letter of invitation to members to serve on the steering committee, which includes some benefits of serving. These benefits include being recognized as a partner of the New Jersey Hepatitis B Coalition and the National Hepatitis B United Coalition. A steering committee member would be eligible to apply to attend the annual Hepatitis B United Summit in Washington, D.C., and a steering committee member could be provided letters of references for grants or applications. Right now, we're planning coalition meetings every 2 months through GoToMeeting. These meetings are scheduled for 1 hour, and our thought is to have the steering committee meet preceding the general meeting by a half an hour, so not to impose too much of a scheduling issue on a potential steering committee member. I hope that I can come back in a year and tell you that this was a successful initiative, but only time will tell. Next slide, please. So on behalf of my colleague Wenqi Chen, I would like to thank you for this opportunity to share our experiences in building and maintaining a hepatitis B coalition in New Jersey. We have our information up on this slide here in terms of where you can contact us if you have any further questions after today's session. I believe we can take questions at this time.
We'll actually take questions at the end, if that's okay, Ruth?
That's fine.
Great. Thank you so much, Ruth and Wenqi. That was a great presentation. So I'll turn it over to Mohammed.
Oh, yes. Hi. Good morning. Well, good afternoon. My name is Mohammed Abdul Qadir. I'm the Hepatitis B Coalition Coordinator for the state of Washington. I'm also the current Hep B Task Force Regional Manager for the Northwest region. And I'm really happy to be here to give this presentation on maintaining a coalition. Next slide, please. And my presentation will be divided into 4 sections. First, I'll give a brief history of our coalition, henceforth HBCW. And then I'll talk about how, maintaining the coalition. But before that, I will touch upon benefits of having a coalition and the importance of maintaining the coalition and what really needs to be maintained. Then I'll segue into the actions our coalition has taken to maintain itself. Finally, I will talk about barriers to maintain a coalition and what others can learn from our experience. Next slide, please. So HBCW was established in 1997, and it was initially sponsored by local nonprofit with the funding they got from the State Department of Health. It was comprised of healthcare providers, educators, and community members. And its focus was on reducing Hep B disparities in the Asian and Pacific Islander communities. Next slide. And the major work it did was it's a community engagement program in which it developed culturally appropriate and effective strategies to reaching the API communities that included promoting, understanding, or raising awareness of hepatitis B in the communities, and testing, immunization, and treatment and linkage to care. Moving on, next slide. Among the things that they produced at the time was, this is again with the funding from the state, there's the Hep B, What You Need to Know, which was translated into many languages, Vietnamese, Chinese, Korean, and Living with Chronic Hepatitis B, which also translated into those languages. But another thing that they created was this little card. It's a patient screening card where patients can take with themselves when they go see a doctor. It was also translated into different languages. And basically what this card said was, hey, I came from a high endemic country with hepatitis B, and I like to be screened. It was designed more to kind of give the patients a little power to advocate for themselves, to kind of empower them. And this was very effective. We use it to this day. It's a very effective card that, that patients take with them to their providers. So moving on to the next slide. And then our history kind of, expanded as the broader refugee and immigrant communities in our area begin to grow. So we moved, and we start including from the traditional API communities. We start moving to East African, like Somali, Ethiopian, Eritrean, and others. And we start providing disseminating information in different languages: Amharic, Tigrinya, Oromo, Somali, Swahili, to name the few. Moving on, next slide. And in 2013, ICHS, which is the clinic that I work for right now, assumed the leadership. And that's because the previous sponsor made an organizational decision not to support the hepatitis B in their sponsorship. So ICHS took over and continued the work and start to even reach to broader communities. So as of now, we have 19 active members and over 200 in our contact list, which represents communities, CBOs, community clinics, healthcare facilities, local and state health departments, faith-based organizations, and local and federal government agencies. So this, in a nutshell, is the short history of the HBCW. But now, I'm going to move on to the, maintaining what it takes to maintain a coalition. As you all know, creating a coalition is an important step, but it's only a start. It's only half of the battle. It needs, coalitions need to be maintained. They're not, sustained. They're not self-sustaining. Some work needs to be put on into sustaining them, or and maintaining them. But before I do that, I'd like to give a little, background on benefits of having a coalition, and importance of maintaining, and what exactly needs to be maintained. In the interest of time, I'm just going to touch upon three main components of the coalition work, and I picked three of the main ones that need to be maintained. Next slide. So the benefits of having a coalition, obviously, is to create structure, to share ownership of common goals, and of course, it's to pool resources. In our line of work, I don't need to tell you this, but scarcity of resources is really a major issue. So the pooling of resources kind of helps with overcoming that problem. And of course, exchange of information, skills, experience, and a collaborative work. All that comes with having a coalition. And of course, to bring together a diverse range of people and organizations. Those are in a nutshell, the few benefits of having a coalition. But why do we need to maintain it? Well, that's because we work in a very dynamic environment. Priorities change, demands change, new demands arise, policies change, personnel change. There's the demographics change, and then of course there's a focus. The focus changes from time to time. So, because it's not self-sustaining, and because we work in such a very changing environment, it's quite important to have a periodic assessment and periodic evaluation of what we're doing as a coalition, in order, if we really need to have it, to keep it going, and thus maintaining it. Next slide. So what is needed to be maintained? Like I said earlier, in interest of time, I've chosen three of the major components of coalition work. And of course, the first thing that needs to be maintained is the identity of the coalition, which by that I meant the vision and the mission statements need to be looked at periodically, the objectives of the coalition, the strategic and action plans, the goals, all that needs to be looked at from time to time to just make sure we're just congruent with the changing environment I just mentioned. After that, another thing that needs to be maintained very well is the member engagement. As you all know, that a coalition without its members is just nothing but a coalition on paper, nothing but an empty house. And in a coalition that strives to make change or raise awareness in the community, visibility is really important. Its visibility needs to be checked from time to time. So those three major components of the coalition work is what we're gonna focus on. And so next slide. So what has HBCW done in terms of this, three components of coalition work? Well, in 2014, we convened 2 community forums. This is as a follow-up of the demographic exchange that I spoke about. Because the demographics in our area changed, meaning that because we start having our communities growing, especially in the African refugee and immigrant communities, so we needed to create a work plan that encompasses all this demographic change. So in 2014, we convened 2 community forums, and the purpose was to create a work plan for the coalition, to refine our goals and strategies, to revise the structure of the coalition, and to implement new action plan. So what we did was we ran a survey tool, and we sent it to the communities, the API and East African community members, and we got their feedbacks. And based on that, we start rewriting or reformulating our structure and our goals and our action plan. Next. So we identified priority areas, and we make sure that this was, again, congruent with the National Viral Hepatitis Plan, which is obviously educating providers, improving testing and care, and eliminating transmission of vaccine-preventable viral hepatitis B. So we make sure that whatever plan we're going to come up, whatever vision we're going to come up, has to include this plan. Moving on, next. So after convening those meetings and conducting the surveys, this is the vision and mission statements that our coalition came up with, which is, I'm sure, is very similar with others. But the Hepatitis B Coalition of Washington envisions a Washington state free of new hepatitis B infections, where all people know their HBV status, all HBV care provided is culturally competent, and HBV outcomes are equitable and disparities are reduced. Our mission: we seek to impact healthcare systems, patients, and community members at risk of, and healthcare providers. So we educate, screen, vaccinate, and improve linkage to care. Basically, it was kind of improved our vision and mission statements as a result of the surveys we conducted and the forums we convened. Next slide. So the next one is, of course, member engagement, and our members, like I said, are like 19, but we have very core members that that come to our meetings on a monthly basis. I just mentioned a few of them here, but there are about 10 of them that are really work very closely with us. And our members ensure that we ensure that all members are participating in partnership activities. We like to empower our members so they can feel that this is their coalition, that they are active members of the coalition, that they are contributing to the coalition. So we encourage shared leadership and collaborative decision making in our meetings. They have equal voice, And so we create this group group identity, and we work on bringing new partners. We go out recruit, like I said, as the new refugees arrive, we reach out to their communities. Right now, we're working with the Congolese community, which is kind of growing in our area. So we really like to bring them to our coalition. So every time we see a change in demographics, we act upon and address that issue. Next. So a tool we used to make sure that our members they feel that empowered is we have this coalition resource directory form in which we ask our members, I don't know if you can see it in the slide, but we ask our members what they can provide, what they can contribute to the coalition. So each member fills this form, and some of them are, hosting educational workshop, they offer translation, advocacy, they offer vaccination, referrals, and share updates, technical assistance, those kind of things. And we do rely on our coalition members for this one because, it's a collaborative work, it's a coalition work, and it's pooling resources. Second is it kind of, gives them a sense of belonging to the coalition. It empowers them. And we think this is a very effective tool. Next slide. Another one we do is the coalition visibility. We maintain that by, of course, participating in health fairs. And whenever there's a health fair, our healthcare workers and myself go and give presentations on hepatitis B, introduce ourselves, give our flyers, brochures, business cards, all kinds of stuff. And we host a community forum every year in May. This year, we plan to show the Be About It documentary, if all goes well. That's in the works by now, but that's what we plan to do. And this community forum is really one of our our opportunity to reach out to communities and recruit more people and introduce our work and, of course, raise awareness. And then we provide trainings to trainers, trainings to providers, and so on. And then we, of course, we have media outreach. We have our social media. We have digital stories that we share. We use ethnic media and radio and newspapers and ethnic TV to introduce ourselves and introduce our work. Next slide. On a larger scale, we work with national and federal partners like Hep B United, NVHR, CHIPO, CDC. I apologize, I don't know why they mentioned APCHO. And we work with them to do some advocacy work. We write supporting letters. We share data. And that way we maintain our local presence and our national and federal presence. Next. So just to keep it brief, barriers that we face to sustaining our coalition, obviously, are lack of Hep B awareness in the communities. This is a major barrier because the less people know about it, the harder it is, and the more they know, the easier it is. So lack of Hep B awareness in our community has been a major hurdle. And of course, commitment level, whenever you do coalition work, focus does not always stay the same. It changes. So the commitment level is another barrier. Locating and persuading influential community leaders is also another problem, especially when there's new and burgeoning communities. The leadership, there's no strong leadership yet, so it's really hard to find a very influential community leader. Of course, resources is always a problem. Funding, money is always a problem. Lack of data, especially with the African communities. When we try to raise awareness, we don't have data that supports us. If you were to tell people that hepatitis B is rampant in your communities, and then we have no data to support that. That's another barrier. Of course, lack of representation is on a larger scale a problem. You know, the marginalized communities are not represented well. So these are the barriers that we face, and we do try to overcome them. You know, based on our capacity. But hopefully, others who face or who start to work community work can anticipate this kind of barriers, and in anticipation that they can actually get prepared to face them in a proper manner. So with that, just kind of summarize my presentation. Basically, I spoke about three components of the coalition work that need to be maintained in order to get it going, and that's periodic assessment of the coalition's vision, mission, objectives, and strategic planning. And two is active participation of members, empowering members, recruiting new members, and third one is maintain the coalition's visibility in the community, local community, and also in the national and federal level. With that, I come to the conclusion of my presentation. Thanks for your time. I know I kind of rushed it a little bit, but just in the interest of time, so we can have enough time for Q&A. Thank you.
Great. Thank you so much, Mohammed and Winchi and Ruth, for your wonderful presentations. We now have a couple of minutes for question and answer. So as stated in the beginning, please submit your questions in the chat box. And I notice we do have a few questions. This can be for both of you. How would organizations that are based outside of the U.S. get involved with Hep B coalitions? Mohammed or Winchi, would you like to?
Well, we live in the time of globalization, and where the communication is much faster than what it used to be. We can take advantage of the internet and email exchange and getting on our contact list, and just in that way we can just maintain. It's a lot easier nowadays, where you can just change information in a swift manner.
Great.
So I think it is Winchi from St. Barnabas Medical Center, New Jersey Coalition. I think everybody knows Dr. Swing is also United States representative in Hep B Alliance, the World Hep B Alliance. So definitely that for this question, I think that our goal is try to just focusing on our New Jersey Coalition first, right? Because that's how we're focusing is. But definitely that our information always be passed by the other members to the other state or to the other nation. So I think that for forming the coalition with out of United States, I think it's from today on it should be the other it should be easy, but it's also have challenge. Like I say, everything is success with our new high techniques, but it's also difficult to really maintain with this high tech, and then the same thing that we are facing in the United States, in our New Jersey state, is how can we communicate? So the same thing that will happen when you forming the coalition outside of the state, communication will be the other challenge also. So that's what I think. I don't know if I answer the question.
Yes, thank you. So we have another question, and we'll answer this one, and then we'll probably have to conclude because we're running out of time, unfortunately. But what methods do you use in persuading influential community leaders?
Okay.
Go ahead, Mohammed. Go ahead.
Well, this is not only a community community problem, but that is just a general population problem because the disease spreads and it can reach the general population. So each population has the responsibility. It's not only community-centric problem, but it's an overall society problem. So each community has the responsibility to share.
For this question, I think we do have some experience try to just recruit community leaders. What kind of so we're using different kind of methods to really just poaching to them, but it's of course it's like I say, it's difficult. Yeah, we do invite community leader because we have members from like Department of Health and New Jersey State Department of Health. So we try to recruit some. We try to just make sure some of the leaders that they participate some of our conference call, and then to see that if they feel this topic will be interesting for their community or for their concern. So of course we also invite some of the leaders from the community to join our first forum, that face-to-face meetings. We do sometimes I don't know it's a really good method. We don't really have one method. It's really good to really approaching to these leaders, but we keep trying for different ways. Of course, we're looking forward to 2017. We're going to focusing on just regionally. So that's also why we after these years we find out that in New Jersey there's really a lot of different. They have their unique. So we try to just focusing on one power to one place each year. So just kind of can gathering all of the resource and then find out a better way to poaching the area, to poaching to the area, of course, to poaching to these leaderships. And then, like I say, it's kind of multiple, I should say multicultural, but this kind of multicultural is not just the people. It's about the people, the system that the people work on. So definitely that every single region we have to using different kind of method to poaching.
Great.
Let me just add quickly to that. The using community leaders such as church and mosque leaders has been very effective for us because they can be heard by their followers. So church and mosque leaders need to be utilized.
Great. Thank you so much for that rich discussion. Since we're over time just a little bit, if we were unable to answer your questions directly today, please do not hesitate to contact us here. We have our foundation website and their Hep B United Coalition website. I would like to thank our speakers, Mohammed and Winchi and Ruth, for taking time out of your days to help us learn more about building and sustaining hepatitis B coalitions. And thank you all for your questions and for participating. Please look out for a message from the Hepatitis B Foundation, which will include materials from today's webinar. Also, we would greatly appreciate your feedback on a short survey as you exit the session. Thank you again and have a great rest of the day.
Thank you.
Thank you.
Thank you.